is the Emergency Medical Minute.
Okay. So, good morning. I was going to talk about Ehlers Danlos this morning. So, anyone familiar with that syndrome? So, it's a pretty common genetic abnormality. The incidence overall is 1 in 5,000. There's actually a fairly new classification system that has 13 subtypes, so we won't kind of delve into each of those in depth, but it's a well-studied genetic syndrome. Some of the versions are autosomal dominant, which means you only need a single copy of the gene to have expression, so can be pretty easily genetically transmitted. So it's basically an inheritable alteration in collagen synthesis and expression. So, as you can imagine, we have collagen in all parts of our body, so it affects different parts of our body in different ways depending on which syndrome you have. Just as a sort of housekeeping thing, the most common thing is going to be the hyperextensible. So these are the people with the ability to kind of take your thumb and put it against your forearm on the volar aspect, or if your hand's flat, you can extend your pinky to 90 degrees. So that's more common, and those are the people that have chronic dislocations and problems with their joints, basically. So far and away, the most common type. The type that's sort of most pertinent, I think, for emergency medicine that we really care about is the vascular type. So vascular type refers to collagen synthesis problems in the vessels and organs. And so these are people that present with early pseudoaneurysm formation and rupture. So the important thing is when you have an aneurysm, like someone develops a thoracic, or excuse me, let's call it an abdominal aortic aneurysm over time. It's usually in the abdomen, and it usually kind of grows slowly over time, and it involves all layers of the vessel wall. Most typically, Ehlers Danlos causes a problem with the collagen synthesis in the vascular wall, and so you get a tear or damage to one of the layers of the wall, and then you develop a pseudoaneurysm within the wall, which is a high-pressure aneurysm, and then those rupture early. So hallmark of people that you want to worry about a lot are young people that develop aneurysms of typical vessels, but also unusual vessels, and then also spontaneous bowel ruptures. So we see people that have perforated diverticulitis all the time, and then maybe under 40. And that's sort of an explainable cause. These are people who have spontaneous bowel ruptures. And then the common presenting diagnostic component of Ehlers Danlos for women that are pregnant is uterine rupture. So there's 12% mortality with uterine rupture that ultimately is your diagnosis of Ehlers Danlos. So kind of an interesting syndrome, multiple manifestations. But if you see someone with hypermobile joints, that may also not correlate to a vascular type. So that's kind of the other tricky thing. Again, the different manifestations of the different syndromes don't all have the same degree of joint hypermobility or one specific type of collagen vascular disease that goes with it. So tricky thing to diagnose, but genetically transmissible, and certainly genetic testing is appropriate for people that are at risk by family history.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.